Thank you for joining us today. As Angel mentioned, this is the sixth session of the UNESCO's Business Council webinar series. My name is Natalia Gonzalez Alarcón. I work on the AI and ethics team at UNESCO. And what we are trying to do here, in general, is to implement and to find a way to apply the UNESCO recommendation on ethics and AI. And one of the initiatives that we have that UNESCO have is the Business Council for Ethics of AI. And this is basically a space, a collaborative initiative between UNESCO and the companies that are involved in the development and use of AI in different sectors. So the idea of the council is to serve as a platform for companies to come together, exchange experiences, and promote ethical practice in the use of AI. And basically, this is what we want to do today in this webinar. So exchange experience, tell stories, and understand how we can leverage the power of AI, but also mitigate the potential risks that it might create. So I'll be moderating today with Angel. And for me, I'm happy to have here our two co-chairs. So Microsoft and Telefonica are the co-chairs of the Business Council right now, and also to have Eugenio from INIT that I will, in a minute, will introduce to our panelists. But basically, what we are going to talk today is about the relationship and the potential that AI has for health and healthcare. So the ideas here is, here's some good practices, good examples, use cases of how different sectors are applying AI to improve the mission or the job of different physicians and healthcare providers, but also to start discussing and having this ethical discussion about the use of data and the use of sensible data that we know are the type of data that we have in this health sector, but also different strategies that different companies are using to mitigate the risk of privacy or even, the biases and discrimination and so on. So I will stop here and I will introduce our panelists today. So we have Almudena Bonet Medina from AI of Ethics from Telefonica Tech. Almudena has more than 10 years of experience in different agencies and consulting firms. She is part of the AI and Big Data at Telefonica Tech. She is leading different initiatives that wants to integrate the AI and the Internet of Things in the development of new products. So I'm happy to have Almudena today. Thank you for joining us. And then we have also Hannah Richardson from Microsoft Research. Hannah is Senior Manager, Compliance and Regulatory in Health Futures at Microsoft Research. At Microsoft, she works collaborative with research teams to ensure regulatory compliance with a focus on data governance, privacy, and responsible AI. Hannah has previously led quality and regulatory for a range of small to medium life science and medical device companies. She's also involved across a range of policy areas, including AI as a medical device, including previously acting as an honorary fellow of the PhD Foundation. So thank you, Hannah, for being here today with us. And we also have Eugenio Biele. I hope I pronounced it well, correctly. Eugenio is the founder and president of INIT. Eugenio has more than 30 years of experience in a fast-moving consumer goods industry between Europe, North America, South America, and Asia. Eugenio is the president and founder of INIT International. He has held different leadership and prestigious roles, including president and CEO of Unilever North America, Nestlé France, Nestlé Mexico, and Nestlé Venezuela. Eugenio has also served on boards such as in Air and Ice Cream, Pelican, Roche, and different others, different industries and companies around the world. Thank you, Eugenio, for being here with us today. And finally, but not least important, is Angel Melguizo. Angel is a regional advisor for UNESCO on artificial intelligence and ethics for Latin America, but globally as well. And he has been leading this effort to create this private sector community through the UNESCO's Business Council for Ethics and AI. Angel has more than 20 years of experience in both the public and the private sector, and in between multiple other roles, he was the Vice President for External and Regulatory Affairs at AT&T Latin America and the Senior Advisor at the Economic Bureau for the Spanish Prime Minister. So we have a great panelists, a great group of panelists. I'm excited to have this conversation with you. And I think we're ready to start a conversation. So let me give you the floor, Almudena, for you to start.
Perfect. So thank you very much for the introduction, Natalia. I'm going to share my screen. So let me check that you can all see the screen properly.
Perfect.
Perfect. So, well, first of all, thank you for the opportunity to be a part of this webinar representing Telefónica as a part of the Business Council together with UNESCO and Microsoft, and obviously also with Eugenio representing in it. My goal today is to review the opportunities that AI can offer in the healthcare field, primarily by providing a different and integrated view of the patient and helping to improve efficiency in national healthcare systems, which are highly stressed due to the saturation of the care services. Some of the data shown in this slide depict the critical situation we are heading toward in Spain and some European countries, such as the significant aging of the population, chronic disease treatment, patient screening to reduce waiting lists, and identifying severe cases so that action can be taken in as quickly as possible. And last but not least, efficiency in the system to ensure that limited resources and use optimally them. These trends are only going to continue worsening, making it very important, very imperative to call for the healthcare sector to make use of the capabilities that AI can offer, exploring its potential and advantages, just as other sectors have been doing for years to improve the decision-making and automating activities. Pharmas or medical equipment manufacturers have already achieved significant advances in early disease diagnosis or the development of new drugs. However, it's important that the rest of the healthcare professionals, managers, and patients experience the presence of these technologies' capabilities in their day-to-day work to tackle the significant challenges that the healthcare sector faces, right? So currently, the level of AI maturity and the technological capabilities at our disposal suggest that we are at a point where things need to change radically. In fact, the healthcare sector, especially the public sector in Spain, where I am placed, is investing in deploying data management platforms known as data lakes that enable the development of use cases providing a 360-degree view of the patient. This coordinated approach allows different stakeholders in the system to access the information they need, ultimately leading to better patient care and treatment. The goal is to involve all the stakeholders, however. It's really important that they get to know how important it is to use the capabilities of data analytics and AI, aiming to realize this vision of the personalized precision medicine and how care and treatments could be tailored for each patient's unique characteristics. To achieve this, it's essential that public-private partnerships work and become even more robust. And to strengthen these partnerships, it's critical that the design of this entire ecosystem is approached responsibly and in accordance with AI ethical principles. Indeed, this ethical challenge might have been one of the major barriers, in my opinion, preventing this sector to enter the AI wave, right? So this highly sensitive data and found difficulties could have been major barriers for embracing the AI wave for the healthcare. Fortunately, the commitment to this critical point, the ethic one, of many of the institutions and companies that are willing to be involved in this view, such as Telefonica, which are representing, are causing things to change. Our proposal is based on 3 pillars that focus on the digital transformation for the entire circuit and the implementation of native digital solutions that help improve the patient experience and also the streamlined processes. To bring this vision to life, it's necessary not only to have data platforms, but also to ensure data governance, right? For those that are not familiar with the topic, data governance is a set of processes and procedures designed to guarantee data quality, traceability of its use, and privacy. Effective data governance allows for the democratization of data, meaning not everyone to access the information that is in the system, but the appropriate information that they need to make the best decision for the patient. To be successful, this governance must come along with a transformation plan that fosters a data-driven culture and promotes a change in how professionals work by helping them develop new skills. And above all, we must not forget that managing data and designing and deploying use cases must involve a trustworthy AI. In fact, as we understand that this topic is critical, at Telefonica Tech, we've been gone even a bit far in this sense, developing a tool that helps companies increase the transparency of their AI initiatives. This tool offers the possibility of obtaining a transparency score on the different versions of their analytical models, based on the analysis of 100 specific parameters of each model. And where in addition, the tool allows that each one of the steps that have been taken in the development of the model, from the dataset to the parameters of the algorithms and so on, are certified with blockchain. So all the construction or all the life cycle of the analytical process is immutably recorded, and the entire process is easily auditable. I'd like to close with 2 practical examples of the initiatives and solutions that we have in progress. In the case that we are that you are seeing in the image, we're talking about the deployment of a platform that enables to work in an integrated and structured and governed manner with multimodal healthcare data. From the patient medical stories, hospital system records, wearable devices, pharmacies, and more, with a special focus on genomic information, which is critical to develop several use cases to help advance toward this precision medicine that we at the end want to reach, right? So the system operates centralizing management and store files of all kinds and massive data, structuring the data, and standardizing and automatizing analysis process. Also with a visualization component that can help the user to use all that information, specifically the genomic one, in an agile, simple, and intuitive way. So it's crucial in this kind of use cases or this kind of projects to emphasize that this is an enabler, and the highest security measures must be taken into account, right? So the data always remains the property of the user. And it is up to the institution to decide what use cases they want to deploy and to prioritize and roll them out. We help them to in the path, and we advise them. And many times, most of the conversations begins with how ethics have to be taken into account in this kind of projects. And maybe you can like start with use cases that are more focused on our rule-based systems or some biomarker detection, and continue growing with more complicated use cases that includes more complicated AI with other kind of critical things, talking about ethics that have to be taken into account. So this approach of growing postly and continue increasing the maturity of the kind of AI that you are using usually helps the healthcare system to adopt easier and to foster this cultural shift that is needed among the stakeholders and that we were talking before. And the second example that I brought is this of the emergency department. Here in this area and other areas in the hospital, is obligatory to use a code-based international classification for capturing all relevant information about the patient. So based on this premise, we have built, along with Solventum, previously 3M Healthcare, a solution to support decision-making in the ER, anticipating two care picks. Using this coding data, the application of analytics and AI makes it possible to understand how the emergency department operates and to predict the number of patients that will arrive in the coming days, which facilities they will require, and how many of them might need to be admitted. So this helps to size the services and provide better quality of care, and obviously to reduce the pressure of the system. And this has been my brief overview of the opportunities of the AI in the healthcare field.
Thank you so much, Almudena. Super interesting learning from your different examples and the different approaches that you have in the pillars you mentioned. So thank you so much. Before giving the floor to Hannah, I just want to quickly tell our audience that you have in the bottom of your screen the Q&A button for you to put questions or comments or whatever you want to share with us, because we will have a couple of minutes at the end, hopefully to be able to reply to some of your questions. So keep it in mind. And now I'll give the floor to Hannah, please.
Wonderful. Thank you so much. Hi, everyone. Thanks so much for inviting me to be part of the panel today. As was mentioned, I'm Hannah Richardson. I'm Senior Compliance Manager at Microsoft Research, and I support the work of a research organization called Health Futures, which aims to empower everyone to live a healthier future. We are a diverse and global team, including engineers, designers, researchers, and medical professionals. For my role specifically, I focus on helping our research teams navigate best practices around responsible AI and data governance. For my section today, I will discuss our approach to responsible AI more broadly, and then focus on a case study around applications in radiology. I am part of a core team that helps to navigate how we infuse responsible AI principles into the work that we do. And it is a great pleasure every day working with research teams who care deeply about putting our principles into practice. No matter the scenario, the focus for us is always keeping a human-centered approach. We recently announced our work with Providence. Providence is a large hospital healthcare organization serving several Western states in the US. The goal of the project was to develop computer models that can take the enormous amounts of data generated in clinical trials and electronic health records to spot a trend, and then prove that a given therapy caused that trend. This project is part of Microsoft's commitment to apply generative AI to precision health. Through our research, we have come to appreciate even more the importance of human considerations when exploring ways to improve healthcare. This includes possible impacts to both patients, but also to clinical teams. Another key learning for us has been how we can make tools impact positively the administrative burden on medical professionals. Specifically in radiology, like many clinical domains, radiologists face challenging workloads and often report burnout. AI is showing early promise in supporting medical professionals with administrative tasks. This includes everything from segmentation of medical images to transcription of speech to text for clinical documentation. We hope our research in time will contribute to patient benefits, including giving clinical professionals valuable time back to more actively engage with their patients and have more time away from computer screens. One example of this is my work with a team called Project Myra. Project Myra aims to build innovative multimodal AI technology to assist radiologists in delivering effective patient care and to empower them in their work. To advance this work, it requires a human-centered, responsible AI approach to development that places clinical utility and careful workflow integration into its core. The technology that we are developing provides the foundation for different applications in radiology. For example, multimodal AI can be employed to automatically detect and draft clinical findings from a medical image, or even to alert radiologists to potential errors in their written documentation. All of this requires close stakeholder engagements and clinical collaboration with real-world healthcare contexts. In the creation of a research frontier with multimodal models, we must continue to do this in a clinically relevant manner. Ultimately, this drives us from just a technical AI innovation towards successful healthcare delivery. Our approach for responsible AI for Project Myra employs 5 key factors. The first one is employing multidisciplinary teams. One of the greatest lessons that I've come to value is that engaging internally with our diverse team allows us to fully consider the impact of our work, both in terms of benefits and risks to our research projects. This includes my work with teams on impact assessments and project compliance teams, where a diversity of perspectives allows us to think more carefully about what we are developing and for who. Secondly, responsible AI principles. By thinking about the people involved in every interaction with the technology and working through key considerations to help drive our responsible AI principles of fairness, reliability and safety, privacy and security, inclusiveness, transparency, and accountability, it is important that we weave these into the work that we do every day to have an effective process for development and for research. Thirdly, data governance, as was highlighted, is a really key consideration for us. This work involves working closely with our team to understand how we will use the data and also with our collaborators to make sure that we have the right data use permissions in place to do our work. It is important to remember that health data always represents a person and likely someone going through a very personal experience. And therefore, it's really important to us that we want to make sure we use that data in the right way as would be expected. The fourth area is around our data strategy. This includes considering diversity of populations and sources of data, whilst balancing the requirements of having the right metadata for evaluating fairness against key privacy considerations. So, for example, if you're including factors like age, ethnicity, and other factors that can lead to health disparity, this can be really helpful for understanding fairness and bias, but it's really important that we understand that impact around identifiability of data. Finally, for number 5, one of the key aspects for us is practitioner engagement. We look to seek continuous input from radiologists. This includes concept reviews and iterations to gain their valuable feedback to inform us how we best build our AI models. Further to this, we also routinely run contextual inquiries, interview studies, and design prototyping sessions to understand the workflow with clinical experts. We are also really fortunate to be able to collaborate deeply with our nuance colleagues. It is valuable to be able to learn from their clinical expertise. Ultimately, responsible AI can encourage us to do better research. We live in an exciting moment in time where we have the potential to understand human biology and deliver better medicine. For this vision to succeed, however, it requires us to carefully consider the responsible use and the right applications of such technology, and always with people in mind. We are mindful that the impact of our work can only be done with the communities and partners that we work with and learn through. We look forward to collaborating with you all on the path forward. Thank you.
Thank you so much, Hannah. Super interesting learning from your different strategies and approaches that you mentioned. And now I want to give the floor to Eugenio Milbiele. to talk about Init, which is a food intelligence platform, and that we will learn more about it in a second. So Eugenio, the floor is yours, and I'll share the screen. You're mute.
Sure.
Now, I think.
Perfect. Hi, everyone. Pleasure to be with you, Almudena, Hannah, Angel, Natalia, and everyone. Excited to share what we're doing. And building on what Almudena and Hannah have said related to how can we really bridge the gap between technology and well-being. I'll start with more a personal story. So as I said from the beginning, I come from the food industry. I worked in the health in different boards, but more importantly, around 10 years ago, my wife was diagnosed with arthritis. And at that time, she was probably going to medicines and take that, build through that, live through that pain for the rest of her life. Luckily, at that point, and given the different studies she had, there was one recommendation: could it be food-driven? And she stopped gluten, and after a period of stopping gluten, the arthritis disappeared. So at that point, this large industry which I work, which is 9 trillion, which is the food market, and the case of this particular point, how could this be affecting? How big is the market of food-related diseases? And incredibly, to my surprise, and maybe to that of others I share, and Almudena, we can go to Natalia, we can go to slides. The 9 trillion market, food market, actually, the food-related health costs is bigger. So we're actually spending more money to heal than to feed the world. And I think this was shocking to me in many ways. But the other thing I would like to share, which I went into more detail, is what is the trend? Is this reducing, or is it becoming larger? Well, actually, it's increasing. And if we project that, and very much to what Almudena and Hannah were saying, I mean, the trends on how we need to address, and together, how can AI help us address these trends? So in that sense, after what happened to my wife, we created, and I'll share a little bit what we're doing at Init, but we identified the great opportunity of how AI could probably help us address these points. And the key problem to start with AI is that AI is extraordinary, and food LMs are giving us an extraordinary opportunity to gain much more information. So as you will see in the next slide, they do provide our elements, but when it has to do with food and health, those elements are not precise enough. And then that creates a trust issue. And for us, it was very important to understand how we could leverage this opportunity where we can take advantage of the LMs to help address these solutions, but at the same time, bring precision and trust. So what we do, or what we have in it, is we build, as you will see in the next slide, this vertical platform that works together with the LLMs to bring that precision, those guardrails, or that insurance policy, that the output of those LLMs will become useful. And what we have seen is that when we combine the large language models with this precision, there is extraordinary things that then it can become useful. And now I'll share some of the things we're doing, and I'll share a real example on how we're bringing this to action, we're bringing this to life. So at Init, just as a presentation of what we do, we are focused on empowering consumers to make more informed choices. So in the next slide, you can see several different examples that we are doing. So we are working in food, like always, to inspire. It's really important. So we make sure that precision that you can get from LLMs turns and realizes in really concrete solutions that you can use and you can use on an everyday. We're working with retail, with brands across the world to do this. It's very important also to inform. So in the next slide, we express how we actually, it's not about the food anymore, it's about your food. And for us, it's really important to be able to not take an experience, but to make it personalized for you. And at the same time, as we've been sharing, that information, that data belongs to you and you can use it for your own benefit. And finally, when we combine inspiration and information, well, we turn to empowerment. And this is where it gets really interesting, right? How can we really have a positive impact above our people's lives? And the example I'll show with you, we're very proud that we've been working with Roche Diabetes Care to bring a solution for people who are living with diabetes. Because when you live with diabetes, it turns into a tunnel. It's very difficult to make decisions every day. It's very difficult to manage those decisions and do it in an effective way. So we worked with Roche and we launched this first solution that you'll see. It's a companion. And this companion helps you across your day. And I'll let you see it, and then I'll share a little bit about the outcomes of this help. Please, there's a video to show this.
Vous avez du diabète? Je suis Phil, votre compagnon qui vous accompagne pour une meilleure gestion de votre quotidien. Personnalisez-moi, vous aurez des conseils adaptés pour l'équilibre de votre alimentation. Grâce à mes fonctionnalités sur mesure, retrouvez les valeurs nutritionnelles de vos produits alimentaires et effectuez vos courses en toute simplicité. Toujours à vos côtés, je vous proposerai un choix parmi plus de 1000 recettes adaptées à votre diabète, imaginées avec des professionnels pour votre plus grand plaisir et celui de vos proches. Comme tout bon compagnon, je serai là pour vous encourager à poursuivre vos efforts dans vos activités quotidiennes. En plus, vous pouvez me connecter à votre lecteur AccuCheck Guide ou AccuCheck Mobile en quelques clics pour suivre facilement vos glycémies afin de les comprendre et de pouvoir agir. Vous pourrez aussi partager vos données glycémiques avec votre médecin afin de lui permettre de les analyser en consultation ou à distance pour un meilleur suivi médical. Phil est connecté au lecteur AccuCheck Guide et Mobile, qui sont des dispositifs médicaux de diagnostic in vitro destinés aux personnes atteintes de diabète. I feel good, c'est bon de se sentir bien accompagné.
So we're very proud of this, and as you can see in the next slide, it's for us, it's one of these magical moments, AI for good. And our role with UNESCO and our role is to try to bring about action and try to bring really concrete things that we can bring to life. And clearly, this is like in my generation, when I first connected my iPod in my car and it was about my music. I think what we're trying to share here is that now we can bring these experiences, now we can have this type of solutions that help in an everyday. And if we can imagine these things going forward, then of course, the answer in the next slide would be yes. Trusted AI, when we combine LLMs with the verticals that bring precision, can help us address the impact. And it can help us hopefully not only address obesity, diabetes, cardiovascular disease, or arthritis, but as Almudena mentioned at the beginning, in the next slide, hopefully it helps us drive prevention. I think that for us, the opportunity of certainly driving prevention and being able to reverse this enormous trend that we see of escalation in healthcare cost, and particularly for the impact that that has for the family, was that was brought home, and that's the example I have to finalize related to what we are doing with UNESCO. So together with UNESCO, we are activating a program, as you'll see in the next slide, that is about closing a major gender gap. And we identified this, that particularly in cardiovascular disease, there's a tremendous gender gap because heart attacks express themselves very differently in men than in women. And over the decades, we have centered 99% of these on men. Unfortunately, women experience silent heart attacks, meaning they don't get the pains or they don't get the different symptoms that we get. They just, get cramps or sometimes just tiredness, dizziness, and this is misdiagnosed. Unfortunately, 25,000 women die each day of CVD. So together with UNESCO, we're putting together a program to address this. And particularly, if you can see in the next slide, it's incredible to see that it's the #1 cause of deaths. I mean, 34% of deaths in women each year. That's more than all cancers combined. And the other paradigm is we always thought that, it was a male-driven type of disease, but you can see here in this chart that is actually female are the ones that are suffering much from this. Unfortunately, all the data that we have in the past and everything that we've done so far won't help that much because it has that gender bias. So we're working together with our friends here at Microsoft. We're working with our friends of across the industry to help address these type of solutions. And clearly the invitation of today and this webinar is to hopefully help everyone. And in the next slide, it was inviting all of you to help us transform these mentalities, and hopefully through AI with capital MEN, we can do that and empower people to live healthier and more fulfilling lives. Thank you. I look forward to opening a session later and answer any questions.
Thank you so much, Eugenio. I think it was inspiring hearing your story and understanding the what is INIT doing and the different projects you presented. I would like to give the floor to Angel to finish our round of panelists and to start the conversation.
Thank you very much, Natalia. It's been a pleasure, and listen to you, Almudena, Hannah, and Eugenio. It confirmed and reassured the way that UNESCO took some years ago under the leadership of Gabriela Ramos of building good AI, and good AI means trusted and with privacy and with rights. And also fostering AI for good, that is driving AI towards what we really value and what we really care. Actually, my points are going to be related to the interventions of the three speakers, the great speakers, on distribution, that is where the resources are and where they might be. More a micro level on solutions that we are already seeing. And finally, on policy, on what we should do and what we are doing. Let me start with economics. I'm an economist, so forgive me on that. But I always like to check market capitalizations and see where the money is, because words can go everywhere, but where is money right now in terms of AI? Well, you guess it. It's on chips, on semiconductors. Okay, Nvidia, the leader of the market, capitalization is more. Just Nvidia, one chip maker, more than 165 global healthcare companies. That is, you sum the CVS, Walmart, Cignas of the world. Well, you have to sum 100, nearly 200 companies to get into the market capitalization of Nvidia. Just Nvidia 6 times Johnson & Johnson, or 30 times CVS. Yeah, you might say, yeah, but it's a very concentrated market, so it's not fair. Well, I took then the first 20 chip makers in the world. Okay, 20. It's already a good share. Well, the 20 chip makers capitalization is nearly $6 trillion, which is the same as the total pharma industry. So 700 companies in pharma, the Johnson & Johnson, Merck, Novartis, Pfizer of the world, are worth 20 makers of chips. I'm not saying that these guys don't deserve the money, okay? They deserve it. They are actually at the building block of these services. But I think when we mean about AI for good is that we want these resources that today are spectacular in developing this technology to move forward to where we care the most. As Eugenio said, I mean, health, food, prevention, education, environment, this is where we think we want to go. And this is why we are fostering these discussions, AI for good. We love technology, but it's important that these technologies are directed to what we care about. And obviously health care, we care about. being a rapidly aging human being, as I am, as one former boss said, I care more and more every day about my healthcare. And obviously, there are very good examples. We heard and listened carefully to Hannah's example on radio with Mayra. We also listened to Almudena. Obviously, we got back to our more or less usual lives after COVID because AI fostered vaccines in an spectacular time. Not just because it was able to analyze data fastest than never in history, but also trials were easier. Identifying adverse effects were easier. Even logistics, even distributing vaccines were facilitated thanks to AI. There are also examples on electrocardiograms and heart attacks. Eugenio, I care a lot about that field as well. Being a man, I know I'm visible, but I care. And these devices that right now we can couple to our iPhones and have, let's say, almost in real time and relatively affordable. Last time I checked on Amazon, I mean, having these devices, making sure that our heart rate is well monitored is so important, and they are triggered by AI. It's important. This is important. And last but not least, and it is very much related with what Almudena and Hannah were saying, amplifying or democratizing healthcare. I mean, we are privileged, all of us in this phone call. There are many guys down there in remote areas, in middle and low income areas where healthcare is a luxury, and they have to choose between healthcare and actually food to use the couple of Eugenio. So this let's say this assessment, these chatbots that are making sure that some populations can access healthcare, and they are triggered by AI. And they are present actually in Latin America, as the ones of the German company Ada Health are good examples. So AI for good is happening. This is great. Now we have to make sure that AI stays good, and this is not always the case. And obviously, in the case of health and AI, and this is my third and last point, I think the connection with neurotech and neuroscience is one of the key elements. Probably the next big thing when we are seeing who is investing in neuroscience and neurotechnology in the world today. It's true. Even from Egypt, we have seen innovations on how to try to relate medicine and physiology, biology, chemistry, even computing, but only recently, because the boom of computing power, the boom of analytics, and the boom of AI, we are seeing neuroscience going to the forefront. If they can better diagnosis, they make a better diagnosis of illnesses, is probably they are great and very powerful tools in order to improve our nervous systems, in order to fight some diseases. But we have to make sure that neuroscience evolves in a proper way, and that's why I think we have to celebrate that UNESCO is already working on it as the only international body that has the mandate to advocate and to perform and to design some rules of the ethics and the sustainability and the responsibility of neuroscience. I think this is the way to go, and this is the way to make sure that also not only we are combining good AI for good, as I mentioned, but also AI stays good. Let me close here so that we have some time for the panel. Thanking you all and thanking the opportunity to share some of these thoughts.
Thank you so much, Angel. I think we've heard different perspective, initiative, some inspiring stories, but I want to highlight before, I mean, to get into the discussion, two words that resonated in my head when I was listening to you guys. One is the changing culture and engagement, and the other one that you mentioned a couple of times was trust. Because what Angel said is the most important thing right now is understand and find the ways on how AI for good, it stays good and it stays in the right path. So turning I mean, now wanted to move into the ethical discussion and how to create that trust in using AI in this sensible and sensitive sector. I would like to ask you, Almudena, Hannah, Eugenio, what is the most relevant thing that comes to your minds when I say trust, and how to create trust not only for medical professionals but also for patients and for people that are using AI or telemedicine as a solution for healthcare care. So I don't know if any of you want to start.
Be happy to start. First of all, I do want to comment that it's the leadership and thank Audrey Azulé, Gabriela Ramos, Angela, and all the UNESCO team, because I think the most important part of trust is leading by example. So the fact that you have created this and you invited businesses like us to be part of it, I think is the first part of stepping into this trust and having this type of discussions. For us, in particularly for in it, is really trusting the output of the results that you get and making sure that those results are yours and you can use them as you decide freely. And I think the most important part of those elements is making sure that the information that you receive can be personalized, can be useful, and I think this is where the key value of that comes. Now, when it becomes useful, as you saw, then you can use it in your everyday tasks, but then you can also use it to share with your practitioner, but you as a person decide to share with your practitioner, and then it turns into a positive flywheel of information that can then have a positive impact in your life and that of your family.
Thank you.
Yeah.
Almudena.
I would like to add that it's also important maybe to make one step behind, and also when we are designing or prioritizing some use cases or helping our clients to decide how to prioritize them, to make also an ethical impact assessment, or also to put into the conversation all those ethical questions that are important to take into account when deploying a use case, right? And the consequences that it could have, or how to deal with the kind of outputs that you are going to have. Or for example, talking about the biomedical system that we were talking before, if we have one score that is critical, when to raise the hand to the patient to say, okay, here maybe there could be a problem, or maybe we are very conservative and we raise a critical alert and the system can handle that, all that treatments and all that questions. So I think that also from the design of the use case and the beginning, we have to reflect in that kind of questions.
Important. Yeah, Angel, you raised your hand.
Yeah, very brief, although then Hannah, of course. But this ethical impact assessment is music for our ears. We cannot unveil what is going to be happening in the next weeks, we hope. But actually, one of the ways in which UNESCO is working with the private sector is making sure that when they are, even before launching some of the great services that they put in the market, they take some, let's say, some caveats, and they do some tests, and they pre-test some of the things that are going to be happening. And this is not just responding to regulation, which is not there yet. It's actually to signal which companies take responsible, ethical, and sustainable AI seriously. Also to make clients and to make customers happier with their services, to retain talent, or even to attract investment. So stay tuned for ethical impact assessment. Sorry, Hannah, all yours.
No worries. I'll just briefly build on the point. So I think the idea of an ethical impact assessment is really important. And I think a key part of both earning and maintaining trust is bringing in the right people at the right time. So if you expect clinicians or patients to engage with an AI system, really putting in the homework to understand it from their perspective, understand how it benefits them, but also, you know, any possible harms and how you might mitigate them. It's not just a one-off process, I would say, is really important as well. It doesn't just happen when you first launch something. It has to be something that I think teams have to come back to and really keep that human in the center of their mind when developing AI technology.
Absolutely, yeah. I mean, you said already, leading by example, trusting the outputs, the practical tools, and how to apply that in practical manners using, for example, the ethical impact assessment, and what Hannah just mentioned about maybe the key is right people at the right time and finding the ways to get it. I think that I'm looking at the time and we have only 2 minutes left. I wanted to quickly make a round about the importance of data, because for me, data DNA, as you mentioned, is the most critical input when using AI. And I know that in this health sector, data is extra sensitive, is it's personal. I mean, I think all of you mentioned how personal it is to use health data from people. So I don't know if you want to quickly share in 1 minute your perspective or your anything you want to highlight when talking about health data. Almudena, do you want to start?
Well, yeah, sure. Well, I think that establish a robust data governance policy is critical when you start this kind of projects for a healthcare system, for example. Usually is the first step that we start doing before deploying use cases and so on. So I think it's part of making everyone feeling comfortable or what you are building, right? So I think that robust data governance is critical. And also now we have many capabilities building hybrid systems, right? They guarantee the privacy and the security on-premise and combine it with the best of the cloud. So there are several opportunities to deal with the security and the sensitive data that we are dealing with in this kind of use cases.
Great, Hannah.
Yeah, I think the key thing for me, and I mentioned this a little bit in my talk, is really trying to strike the right balance. So it can be very easy for AI systems to be quite data hungry, but actually thinking around what the right data you need for the application is, what kinds of metadata do you need to be able to prove bias and fairness, and then just kind of really working with, you know, clinical teams, if relevant, to actually understand the workflow context so that you can power your AI appropriately, I think is the most important thing.
Eugenio, you want to
Yes,
add
and
something?
from our side, I think just reiterate how important it is from the business and entrepreneurship side. So particularly as you run your business, and you can take into account many other elements, but I think what Hannah mentioned is so important. Earning trust takes a lot of time. Losing it, it's just a few seconds. So if we live by that and we empower the consumers to own their own data, to use it, I think we will see tremendous opportunities of how we can look at the glass half full, of how now we can use all these elements and really begin driving not only the problem, but then it becomes part of the solution. And hopefully we can now move into the prevention part and have a very positive impact to truly have across everyone to live healthier lives.
Yeah, absolutely. I like that last point. For us as consumers and users and as owners of our own data, how we can also help to make it more or trust, right? So I want to finish it by giving you the floor, Angel. I don't know if you want to share some closing remarks or some final thoughts.
I just wanted to thank the panelists and share what would be like a summarized tweet. I'm not sure if the old rules or the new rules by Elon Musk, but let me try insist on our main line. It is, yeah, we all are on board on AI for good, but we have to go beyond words. And I think the point on distribution, the point of chips versus health services or health versus food are clear examples. So AI for good should mean going beyond words, with words, but beyond words, and direct the resources to the services that really improves our lives and the lives of the future generations. We have discussed in these webinars on education and culture, if important. We are UNESCO, so obviously we have to say that first. We have touched environment, but we have discussed today health, and I think these trio are crucial.
Thank you so much, and thank you again, Hannah, Almudena, Eugenio, for being with us today, and for the participants to stay online the whole webinar. Hope it was a great conversation, and thank you so much.
Thank you.
Thank you.
Thank you very much.
Bye-bye.
Bye-bye.
Thank you.